cancer. Uh, in Fiji, there is no breast cancer screening program, like existing. So, but like only in the private sector, like for us at Super Private, we offering the screening program. But the screening program, as I mentioned, like it costs money with us. But like sadly, in the public system, for our people, for our mothers in the villages, common women, there is no program. There's no breast screening program available for them, which is a shame to me. And now it's only the people who can afford they get screened. So, but at the public hospital, what they do is the people only with lumps that are fell with the lump, then they do the mammogram for them. So these are the people who already have the lump, but the people who don't have the lump, who are not diagnosed, they don't do the screening at the public hospital. It's my concern is like because I involved with breast screening and breast management, like here in the Super Private because I'm based here. My concern is like about this Pinktober is like what has like the government do to accommodate the public, the people who can afford to pay for the private sector. Like I think to me there is none to address the majority of our women in the especially in the rural, in the semi-urban areas, who can afford to go to private hospital to be screened. And I think this is one area that I think the government or the Cancer Society or this Pinktober thing, like with all this fundraising, either they can supplement or they can, totally fundraise to help fund this program, the breast screening program, to accommodate especially the people who can afford it. Yeah. But fortunately, the people in the business sector, the civil servants, like people who can afford, people who have insurance, they pay for them to come and do the screening with us at the Super Private. So with its screening program, what we do is like we do mammogram and ultrasound. The mammogram is X-ray of the breast. So this one we have age limit. The age limit is like we take like 45, 50 and above. The reason is because of the risk of radiation on the breast and in young women, and also because of studies showing that breast cancer is high amongst the older age group. Okay, so that's why we put the screening program, the mammogram, only up to cutoff level. We tend to accommodate the lower age group below 45 when there is like a high suspicion or there is a very strong family history and or people feeling symptoms of the breast, then we do mammogram, especially people below age of 45. But the majority of people below age 45, we just do ultrasound scan for their breast, which is non-radiating, what you call method. Okay, the other thing that we do is once we do the screening, if we find something suspicious, then we inform the patient. Then from there, then we work it up. Either we do a biopsy, like to test the lesion and send it overseas for assessment, or we pass it on to the surgeon to evaluate from there. That's how we basically do our management for this breast patient. But if it's normal in the first screening, everything is okay, then we tell them come back in 2 years. But they can come for ultrasound every year. There's no problem with them. But for mammogram, we advise them to come every 2 years.